Thank you, Leanne, and good morning to everyone. I'm pleased to be here with Drs. Bernard and Durbin, and we're going to talk a little bit about the clinical and research integration aspect of the plan. And as I look back at the last 5 years in the prior strat plan, I'm pretty much absolutely amazed by the progress we've made in all of these areas, including those listed on this slide. And I won't call out every one of them, but I'll just mention a few. We've made tremendous progress in quality and safety, of course, research growth, and then population and health with a dramatic growth in PFK. Next slide. So going forward, we not only want to focus on best outcomes, of course, but we really want to lead the nations in best outcomes. We'd like to demonstrate for the entire country how best to do this, how to advance progress in all these areas, focusing on outcomes. Next slide. And of course, as we do this, we want to always focus on patients and families. So the patient and families at the center, surrounded by these integrated clinical and research programs. And really, we want to just talk a little bit about how best to do that going forward. And John, this concept of clinical and research integration obviously is not new. It's been in prior plans, but as you look forward, can you think of ways that care might be different in, say, 2026?
Integration of clinical care and research has been a priority for a long time, but I have to say in 2021 and in the years beyond, the opportunity's never been better to integrate clinical care with research. There's still a lot of frontiers in pediatric medicine, answers that we don't have, and to give the optimal clinical care, we have to marry research projects and research initiatives alongside clinical care. And so we've had areas over the past years where we've really tried very tightly to integrate clinical care and research. We will continue to do that, and we'll expand into some more of them. As we reinforce our core integrated services, we will build some new destination programs. So families are desperate. They're looking for answers, and they often need to pursue their health care at places where cutting edge research is being done to get the best answers for their child. And an example would be a destination program that we will be building related to fetal care. This will be led by Dr. Yinka Oalatoya, our Surgeon-in-Chief, and his capable team. And this graphic shows how we will integrate a research program with outstanding diagnostics, consultation opportunities for families who are interested in the optimal outcome of their baby, even as it is still in the womb. And we'll create this integrated program that has research and clinical care as shown on this slide. Partnerships are really important. The right-hand part of the slide shows many of our local and regional partnerships, which are so critical towards developing this destination program. And then on the last slide shows a lot of our geographic opportunities to expand in the Dayton area, in particular in the Toledo area, as regional partnerships become more important to us in the years ahead.
All right, thanks, John. And then Dennis, can you talk a little bit about how the research will support clinical going forward, and then maybe just the overall growth of the clinical or the research enterprise that you expect in the next 5 years?
Yeah. So first of all, as my first strategic plan, I'm really excited and grateful for the continued support of the institution in research, and it has positioned us well, as you both said, to now assume really a leadership role as a pediatric academic medical center nationwide moving forward. There are going to be 3 principal areas that will focus attention in the research strategic plan. One, we want to invest in some new areas of opportunity. As a continually growing, evolving research center, we want to be opportunistic and go for areas with even greater impact. So as JB said, the fetal therapy program will definitely have a research component to it. Our population health and health equity programs want to be sort of recommitted to those. And we're identifying kidney research as a new opportunity for us moving forward. We also do want to sort of double down, so to speak, in the areas that have already been identified as priorities for us as an institution. These were identified in prior versions of the strat plan. As you said, this concept of integrated clinical care and research is not new. So we want to continue to invest in those areas of excellence that have already been identified for us. And on the next slide, we sort of call out what those areas are. This is in the current strat plan. These remain key priority areas for us moving forward. So as an example, that marrying of the gene therapy work that's done in basic science and translational research in the Center for Gene Therapy with the neuromuscular clinical program. We want to advance all of these areas to their next level of impact and influence across the country. And to do that, we've got to augment some infrastructure. So on the next slide, that infrastructure comes first and foremost in the form of people. The scientific talent, the faculty, the trainees, the research scientists across a whole host of scientific disciplines, but we increasingly recognize that certain key scientific competencies show up in many of our research programs. And we've got a great foothold in many of these areas, and this will be a priority area of focus for us moving forward. We want to be able to take that basic science discovery and translate it into new therapies, so we're going to augment and build out our clinical trials and clinical research capabilities to be able to do that. And finally, all of it has to be done in expanded and renewed facilities. So as everybody knows, we're currently completing RB4. We'll get that fully open and on board as soon as possible in the strat plan. There are plans to renovate the Wexner building into a clinical research center, and then already sort of distant planning for what comes next in terms of continued growth in the research facilities. So that's where we'll be focusing our efforts.
Great, thank you. And then for either or both of you, do you just think of any other examples where this clinical research integration might result in better outcomes for patients and families?
Yeah, let me give you the example of our neuro-oncology program, our brain tumor program. So just getting started in its newest iteration. And it's fun to think about what has enabled what we believe will become a national and international destination program for us. So we now have the genomics capabilities that enable us to offer opportunities to families who have a child with a brain tumor to have really state-of-the-art precision medicine approaches to their brain tumors. We have biobanking capabilities that are unique internationally. We have the ability to support collaborative national and international clinical trials, which these kinds of rare diseases need to enable the research to be done. So when we recruited Dr. Mariam Fouladi recently to lead our brain tumor program, it's really the first time in our history where we could support this kind of integrated clinical and research program to a degree that is so exciting to think about. She brought an entire team with us. So that sort of formula, which really we're only now able to pull off in many different areas of pediatric medicine, we can repeat that over the course of the next years as we build additional destination programs at Nationwide Children's. It's such a key component to our growth strategy, and that's a great example in my mind of how we can follow a template for the future.
Yeah, and maybe building on that, I would say, because there'll be examples in the brain tumor program and in the oncology programs of what I've referred to as biologic treatments or living treatments, so cellular therapies, immunotherapies. These are areas of great promise, and I think we will be in a position to see very different outcomes for kids in cancer, in neuromuscular diseases with continued expansion of our gene therapy programs, in congenital heart disease with expansion of the tissue-engineered cardiovascular research program. Those are really exciting areas of leading-edge science that we're well positioned to advance over the next 5 years. And I would probably finish by just saying maybe something completely distinct from that is the emphasis that we will now have in integrating our clinical and research behavioral health programs. Really leveraging off the extraordinary commitment the hospital made to putting up the behavioral health pavilion, expanding a whole host of integrated inpatient and outpatient services. We want to be in a position to really leverage that to advance research knowledge in behavioral health and to turn that knowledge into new treatments. So it'll look really different than this leading edge sort of biologic living treatments, but as an institution, we're going to be able to do both of those things moving forward, which is really exciting.
Okay, thanks to both of you, and I'm going to turn it over to Patty McClyman, who I believe is up next.